medical dilemma.
Welcome back to Medical Dilemma. Before we start the discussions for the second segment, we'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment of our show are my co-hosts, Attorney Sarah Jane Sugitan, okay, and Doctora Attorney Teresita Sanchez. And of course, we have our guest, Dr. Gomez. Okay. Now, earlier we were talking about a basic definition of gender sensitivity, and we started with the use of terminologies or words that are not sexist. Okay, and I think one example would be the word chairman, or changing it to chair or chairperson. And lately I heard you say the word history.
Oh, yeah.
Okay,
History, pati yun, ha?
which has to be changed to her story,
Yeah,
if I'm not mistaken.
No, but I have to admit, I got that from Google.
Oh, you got that from Google.
But you know, if it's something neutral, history is neutral. Why do you have to identify it with a his or a her?
So the narrator of the history is a man. So, so
Oh.
sexist. So they said it should be her story.
I think nobody's conscious of that. Are people conscious of that his and her thing?
Well, I
Really?
wouldn't know because I'm not an expert on the English language.
I don't know. So what do you think, Sarah?
Oh,
What do you think
I-
about it? Hindi naman masyadong overacting na ata yun.
Hindi, that's why, being gender sensitive means to move from traditional stereotypes into a more inclusive language. As you said, your query earlier is it just about terms? Actually, it is, because language is very powerful. When you call
Yes.
something, for example, from a male perspective, it defines a whole world in other words. So, katulad kanina, yung sa history, we don't know. No? I think history comes from a Greek word, but I can't be I can't be sure if it's really a gender sensitive word. But
Pero noong unang panahon, wala pa yan eh, di ba?
walang ganun, Doctor.
As
And
a
I
matter
think
of fact,
history
early
came from a
70s
Greek
lang.
word that
Oo.
does not necessarily mean that it's a male perspective, no? Pero kaya nga, that's why sometimes the Filipino language is better in the sense na, for example, when we refer to humankind or mankind, di ba? We say sangkatauhan.
Sangkatauhan,
Or yeah,
that's
something
right.
like so that in itself is naturally gender sensitive language, no? And like even pronouns, he, she, his, her.
Yes.
Kaya kung papansin mo,
Right.
Sunny, when during our interviews, I always include his, her, gano'n, yung
Yes,
para lagi
that's
ko
right.
silang
Oh my
ini-include,
gosh.
which is quite
That's more
at
expensive
ease.
sa literature. Imagine if you always have to put
Yeah,
a his
to
and a
replace
her.
everything
You'll be paying
with,
just for
for
those
the,
extra lines.
So that's why
and
one
words.
practice in writing in English is to do everything in plural. You know, like they, then you become gender neutral. Yeah.
Sorry,
Yes,
that's
Doctor.
why the
Yes,
Spaniards
Doc.
got it right. So their language is genders. They have genders,
sensitive.
gender sensitive. Doctora, doctor.
Yeah.
Yeah. Medico, medica. They have female terms, pronouns, and male pronouns. So
Okay.
that's
Now,
the Spanish language.
going beyond the use of terminologies or words, the issue of equality between male and female, or I don't know how else to put it. When it comes to the medical practice, as you mentioned earlier, among peers, there seems to be no problem. But what about between, let's say, a patient and a doctor? Let's say a female patient and a male doctor. Okay, so would there be sensitive areas that need to be, aware, that we need to be aware of as practitioners in the medical field?
Well, that's a very hard question. but
I don't know what.
but since I took the workshop, you need to think before you speak. So, in short, don't say anything that hurts anybody's feelings. If it's going to hurt the feelings of a person or a patient, watch what you say and think before you talk, and probably use your common sense if it's going to hurt.
Especially in relation to the
Yes,
sex, right?
Yes, that's correct. I think it's not the sex anymore. It's is it going to hurt the feelings of the person you're talking to? Probably. But I'm sure if you do a lot of research, if you call experts on this subject, probably they can give you a lot of examples. But personally, I don't have any right now.
I think the law on sexual harassment, we do have a law in the Philippines, and I
Yes,
think that
that's
also addresses this gender sensitivity in the sense that if, for example, you just post pictures of ladies, no, or in the nude or whatever, it can really offend the female sex, and therefore they can be liable for that. So there are laws that protect us also.
Yes, that's
These
correct.
different genders. Yeah? How about the same sex, for example? Is this included in the definition of gender sensitivity? Doc, what do you think?
Excuse me, could you repeat that again?
Sorry, about same sex. Yung mga kunwari,
Oh.
tomboys or lesbians or even
Gays.
homosexuals or gays, what they call themselves. So now, are they included in this gender sensitivity?
Well, to put it bluntly, they are people, so they have feelings. So like I said, it's going to hurt their feelings. I think they are included. But I don't think there's a pronoun for the third sex right now, but they probably will in the future. But right now, basically, does it hurt his
English,
feelings,
those,
or it will expose him to a lot of embarrassment? Maybe you have to tone it down what you say, or say it diplomatically to the patient.
I see.
But they're people, so basically the same rule follows.
So just being sensitive just to the gender of a person
Yeah.
or what they want to be, their behavior, I guess, what they want to be referred to,
Yeah,
right?
You could belittle, like, for example, there's some picture, puts him in an awkward position or exposes his body. If you're insensitive to him, because like the boys, don't care if you're half naked or not.
That's right.
Yet there will be some guys who
The
might
third
be
sex would
conscious.
probably will, and the females, they will be very sensitive if you make fun of it or make it so trivialize it. If you trivialize it.
Yeah. For example, if they're supposed to be men, so you don't want. But some gays really don't want to be exposed.
Yeah,
Certain
yeah.
parts are
Yes,
not.
that's what I'm really curious about. You know, when, let's say, well, in fact, not just members of the other genders, but gender orientations, but you know, like let's say a woman would go to a male obstetrician. I mean, with my wife, I've had this experience. Okay, she said that she was uncomfortable, you know, seeing a male obstetrician. I don't know how, you know, how male obstetricians would approach such situations, how they would assure a female patient that everything is all right.
But Sarah, I think it's just, we're the females here, right? But I think it's just a matter of preference or choice. Some women don't mind going to male obstetricians, for example, because they see them as doctors, not as a male or a female doctor, but as somebody who is competent. As a matter of fact, in our field, obstetrics and gynecologies, or we call the male as the late bloomers, kasi hardly any young patients would go to them because that is our culture, I think, no? Even the males are kind of zealous, they want females. So that, but however, the more respected ones, gynecologists, really are, there are a lot of males who are also very respected in that field, no? And there are certain specialties, right, that are predominantly male, predominantly female. Orthopedics would be male.
But lately, there's in PGH, for example, there's a lot of females in the training program.
Oh, I see.
Sometimes it's more females than male.
But you know, I really think personally, I had an experience with a dislocation of my arm recently. You need strength, you know, and I think that's one thing we, as a female, we might have a little less of that. So, but there are hand surgery. That's where you need the fine manipulations of a female. So it does not really matter, whatever your line
Well,
is.
in anesthesiology, like intubation or putting an endotracheal tube in a patient, that requires strength if the patient's huge. So the males would have an advantage. It's good that we have new devices to help the females do that procedure. For that particular situation, sometimes the male anesthesiologist, because of his strength, can do the procedure easier than a female.
You know, I realize that only now. Actually, before it doesn't really matter, male or female, no?
Well, the patient's
Meron
300
palang
pounds.
difference.
So it would take some strength to do a certain procedure. It would require strength of your arms. So, but with the new devices, everything's equal right now.
So even in technology, we
The
have
technology
gender
is-
sensitivity.
Yeah, it's helped in the gender sensitivity of the whole thing.
I see. Okay, so there is really no question about, you know, the interaction between, let's say, male doctors and female patients, or vice versa.
Yes. Only lang, as usual, we do not, we respect the wishes of the woman. And even if she doesn't say anything, the fact that sometimes women are more sensitive about their parts, their body parts, no? We are more careful because they can really be liable for sexual harassment or whatever. We respect the fact that a woman is female or a child for that matter.
So you mean to say, Doctora, that there's a chance that a male doctor could be accused of sexual harassment by a female patient?
Oh yes, why not? That's why we always
Even though
advise
it's like
that there should,
unintentional.
yes, there should always be a third party around, especially if it is the patient is a female and not and the doctor is a male. There should really be a third party so that no questions asked. Lalo na kung
It's very
minsan under anesthesia, sometimes there are hallucinogenic drugs, right?
Yeah.
And they can imagine that they have been touched when they, in fact, they were not, because there was even no divider in the door. Impossible to have done something. Even the period of time could refer to. What do you think about it? Have you had experiences?
Oh, no, basically it's all about trust. You have to trust your physicians. Yeah, that's why people with good values should become the physicians. You see, like the situation you said, if you want to do something wrong, well, that's a problem. That's
But
why.
as a rule, the doctors, even
Yeah.
before in olden times, the family doctors usually male.
Yeah.
Yeah.
As a matter of fact, they're being seen as competent, more competent, but actually, in truth and in fact, they're both equally competent.
In the operating room, I make sure that my patients are dressed and their decency is maintained. Make sure of that.
Are you conscious only because the patient is female, or even with the male?
Well, now, if you want me to be honest, I'm more conscious for females patients, but they should all have the same treatment. But now that you mentioned it, it should be all the same. But I treat the female even more.
They complain
With
more.
with more careful and for decency purposes. I treat the female even more, so I'm not sensitive to the male patient.
Now, what about our present society? Do they accept, the Philippine society, do we accept the so-called third sex or not? What's your opinion, Sarah?
The LGBT, to be more specific.
Well, the law does not, no, when it comes to, for example, for defining marriage. Then that's where our lawmakers should come in. Because this is not the work of the church. This is the work of the state to recognize civil unions. So we
Yes.
should not pass the buck on to the church and say na, oh, you're contra everything. No, it should be our lawmakers. It should be the state that should be recognizing that there's a new kind of union that's not necessarily man-woman. It could be woman and woman and man, that is presenting a new, I'm not going to say problem, no, but it's presenting new dilemmas in the legal field. Like, for example, I've had clients who consulted me, okay, 2 lesbians, namatay na yung partner. Now the family's going after the partner because she got all the property, she got the bank account, etc. Kung mag-asawa yun, legally married, we wouldn't have that
No
issue.
question,
Oo,
yes.
kasi the wife gets everything, kasi siya yung legal heir.
Right.
But in that case, where there is no law, di ba? So that's when the partner loses everything. So the law leaves a void that should be addressed by our lawmakers, so not necessarily the church.
Okay, excuse my ignorance about this issue. So the LGBT community's demand is actually more for legal benefits?
Well, the way I see it lang in the questions that come up, no, the legal needs or during the consultation that come up is, paano yan, attorney, paano yung asawa? And pwede ba namin i-demanda? Can we sue the partner? Kasi nasa kanya lahat ng property ng kapatid namin na namatay, gano'n. So that one is hard to answer because there is no law.
There's
eh.
nothing
But
to
actually, since they both were working together, involved in that particular endeavor, maybe you can say that they are co-owners of a property.
Yeah,
Is that
there's a
allowed?
partnership.
We know that for second and third partners, no? But what about for same-sex? The same? Is it the same, more or less?
Well, they can argue that there's a partnership. But in terms of succession, technically, ang heirs are the siblings or the parents.
But being partners, they can say, I own half already of this,
Oh yeah, if
this thing
there's
that they both bought, for example.
Yeah, if there's a conjugal partnership of gains, yes, or if they
Pwede
work
rin
together.
yun.
But how do you separate which fund is one partner's and which one is the other's? Diba?
So they should be very careful, no?
Yeah, so
uh,
accounting. But
yeah.
during the relationship, you're not accounting for everything, right? You're not gonna,
Right,
o ikaw yung pasok ng 100,000, akin yung second 100,000.
Yes.
No, you don't do that during a very,
Oo.
especially a very happy relationship. So that's where the law leaves a void, and that's something that, creates a dilemma, a present-day dilemma.
So
for
our
many
new
people.
members of Congress, the next election should be able to address that.
I guess
Yeah,
the
that's
same dilemma can cross over into the medical field, especially when we have to get consent of immediate
Yes.
family members. So let's say the patient is a lesbian and the partner is there taking care of the patient. So does
gives
that
the
qualify
consent?
to?
Yeah.
I go to the medical legal
yes.
officer.
No, we have
We
what
should
we
give the
call
consent.
the durable power of attorney, even the
Yeah.
living will, etc. We'll discuss that later.
Okay, okay, that's good because I think that's one
That's going to
question
emerge,
also.
right? Or in
that,
the operating room.
Actually, there was a law, right? A bill, rather,
Mm.
involving those. But since it's so hard to pass a bill, so it was never passed.
Oh, it was
But
never
in the
passed.
states, they do recognize that. I will explain it later.
Okay, sure, no problem. Okay, so going back to what we have now in the law, is it absolutely zero that the LGBT community members have nothing to depend on?
Oh, as Dr. pointed out, you can argue that there's a partnership. So conjugal, yung mga nagli-live-in, for example, who don't have the benefit of marriage can be considered conjugal partners. No? So they're still spouses and they have, they have property sharing.
Yes.
No? Kaya lang, I think what the LGBT is fighting, and I'm not speaking for them, so I don't know what exactly, if they have specific demands, are, union, no? How to recognize their unions. And kasi ang complications yan is, of course, they're going to, eventually, maybe they'll have family, and they will. So, adoption.
Or they adopt,
etc.
right.
Yeah, adoption, etc. Ganon. Or, Sunny, there's even a case in the States na two ladies who had a sperm donor, and then eventually they divorced.
Yes.
They had a kid through that anonymous sperm donor. They were able to track who the sperm donor was and demanded support from the
sperm
father.
donor.
Yes, and this parang malayo na yan baka it's in the future, but these questions can crop up. And unfortunately, we don't have laws here that will tackle those kinds of dilemmas should they arise. And they will arise in the future, in the very near future.
Okay, thank you so much for that, Attorney Sarah. We'll have to take another break for a few words from our sponsors.